Hi everybody, welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. In this video, we're talking about how to fix bunions. First, we'll talk about the reasons why we get bunions, and then we'll get into 17 tips and tricks to cure bunion pain. Please like, subscribe, and share your best tips that you've found to be super helpful for fixing your bunions in the comments section below. Pressing the like button will also help get this information to others as well. If you have someone in your life who you want to help, please share this video with them too. Also, remember that this video is purely for informational purposes and does not in any way replace any advice given by your own healthcare providers. If the exercises or information suggested aggravate your condition, please stop and ask your healthcare provider for further direction. So let's get to it. A well-functioning foot has 5 straight toes with equal spacing between each and a Goldilocks stabilizing arch, meaning an arch in your foot that is not too high and not too low. Bunions, also known as hallux valgus, are a result of the big toe being pushed towards the other toes. That big bump on the side of your big toe where your bunion is actually inflamed tissue and bone that starts off red, swollen, and painful, and eventually ends up very enlarged, stiff, and stuck. At its worst, the big toe can cross over or under the second toe. There's a reason why there's a huge market for big and ugly shoes. Here are the 6 top reasons for getting bunions. Number 1, flat feet. Our foot shape can be hereditary, and babies and children will have flatter looking feet until about 10 years of age. But our arches can also get weaker with age and get flatter and fatter after pregnancy. That's why it's a good idea to look beyond the written shoe size and just focus on how your shoes feel. Number 2, stiff ankles. When our foot can't bend upwards smoothly and fully, either because of tight calf muscles or a stiff ankle after an injury or fracture, we tend to compensate when we walk by turning the foot outwards to get more movement to propel ourselves forwards. This leads to more pressure on the outside of our big toe, pushing it towards the other toes, kind of like you're skating. Over time, in addition to bunions, you can get pain and cartilage damage in the knees. Also, something to note is that one ankle can be stiffer than the other, or we tend to put more pressure or stand more on one leg or another, which explains why bunions aren't always on both feet. Number 3, weak foot and hip gluteal muscles. The weaker your abductor hallucis muscle, which is the muscle that runs on the outside of your big toe along the arch, the more your big toe can start to drift inwards. How do we strengthen it? I'll show you a really simple way later. Number 4, walking with your feet outwards. I know we talked about this earlier, but there are other reasons as to why people walk with their feet outwards. Sometimes it can be a knee malalignment, commonly known as knock knees, where the knees touch each other and the ankles splay outwards. Sometimes tight hips make you turn your legs outwards. Sometimes we walk that way out of habit. Number 5, poorly fitting shoes. Your foot will take the shape of your shoes over many years. So as a teenager and into your 20s, you can pretty much get away with wearing any type of shoe. But after that, the sweet memories of being able to wear pointy-toed stilettos and rounded toe boots will soon turn into horrible foot pain, and you'll have bunions and a squashed foot as a souvenir. However, out of all the reasons as to why we get bunions, tight shoes are truly the easiest fix. I will say that there is a lot of trial and error involved. In general though, if your foot is truly flat, regardless of whether you are sitting or standing, or it is hereditary, you may find that you do need a very supportive shoe that is higher in the arch. If your foot is flat only when standing on it, and you don't have any other issues like plantar fasciitis, arthritis, or diabetes, try barefoot type shoes that are wide in the toe box and flexible. Barefoot shoes are great for retraining the muscles in your feet. Number 6, arthritis. If you've had big toe pain for years and can barely move your big toe because it feels stuck, chances are you have arthritis. You can have osteoarthritis, which affects a single joint from wear and tear, or inflammatory arthritis such as gout, rheumatoid arthritis, or psoriatic arthritis. Gout, which is the accumulation of urate crystals in the joint, often presents itself in the big toe. Gout pain can come on suddenly, The big toe will be hot, swollen, and extremely sensitive to touch and movement. Even the gentle pressure from a bedsheet can feel excruciating. However, the good news is that prescribed medication can really help bring down the inflammation and pain quickly. Make sure you see your doctor immediately. While it's true that you can't get rid of arthritis, there are things you can do that can stop it from getting worse, or at least give you better foot function and better pain management. The main steps of arthritis treatment are: step 1, support proper joint alignment. Step 2, control the inflammation. Step 3, restore as much movement as possible. Step 4, strengthen the surrounding muscles as much as possible. And finally, step 5, celebrate with a pain-free happy dance. So depending on where your bunion falls on the scale, from a small swollen bump to a full-blown toe crossover situation, these following 17 bunion tips can help you correct the alignment, or at least help to take away some of the pain. Tip number 1, ice. Put your feet up and wrap an ice pack around the swollen bump on your big toe for about 20 minutes, especially after you've been wearing your shoes for a long time. Number 2, use toe separators or spacers. An easy way of fixing your bunions is to put on toe separators, the kind that is used when applying nail polish to separate the toes. Try putting them on overnight first. At the beginning, you won't be able to tolerate them for too long, but gradually the toe separators will become more comfortable as you wear them and as your feet adapt. You can also buy big toe spacers to wear during the day when you are walking. Again, at the beginning, they can feel uncomfortable, and you will likely find that your toe box feels too tight. But as your big toe gets realigned, the toe spacer will start to feel more comfortable. The best results happen when you use the toe spacer plus buy a shoe with a larger toe box. Number 3, get rid of your pointy shoes. Buy shoes that are wider at the toe box. If you have calluses, chances are your shoes are too tight, especially if you factor in thick socks. Shop for shoes in the afternoon when your feet are at their biggest. Wear the socks that you like to normally wear and bring along your toe spacers. Don't just go straight to your normal size. Play around with half sizes up or down, and keep in mind that one foot can be bigger than the other. Stay away from really stiff synthetic materials at the toe box. Consider buying natural materials when you can, like leather and rubber, because they breathe and stretch better to accommodate your foot rather than squashing your foot. Number 4, go barefoot when you can. This tip is more for people who have mild bunion deformities caused by tight shoes, not so much for people who also have heel pain, otherwise known as plantar fasciitis. Later on, I'll talk about when it's not good to go barefoot. Number 5, socks with separate toes. Let those toes spread out instead of being squished by conventional socks. Keep in mind that you will likely have to find new shoes to accommodate the extra material. Number 6, hiking style boots that straighten the ankles. If your feet curve outwards like a duck, then chances are your ankles are weak and your calves are tight. By wearing shoes that tie up higher at the ankle, you can help straighten out the ankle and give yourself more support. People who walk a lot for work should consider sturdy work boots for this reason. Number 7, wear orthotics. Sometimes you can do all the exercise you like and your feet will always be flat. This is when custom orthotics can really help. Orthotics are molded plastic inserts that go into your shoes that are customized to put your foot into the correct alignment. Think of them like dental braces, but for your feet. Just like dental braces, they can hurt initially, but over time, they're meant to lift your arches and redistribute the forces that go through your feet when you're on them. And just like braces, they should really be worn all the time to be truly effective. A healthcare professional like a podiatrist or physiotherapist will do an assessment of your postural alignment, range of motion measurements, strength, functional abilities, and then make a mold of your feet. From that mold, along with the results of the assessment, they will make an orthotic that is specific to your feet. These are called corrective orthotics because they are meant to correct the shape of your feet. You can also buy what are called accommodative orthotics at a drugstore or online that have gel or padding that are made to work with your existing foot shape to cushion it and make your shoe feel more comfortable. So rather than correcting your foot shape with hard plastic, they are adapting your shoe to your current foot shape. These off-the-rack type shoe inserts can be wonderful for minor issues like blisters or formal shoes, as well as for diabetics and severely arthritic feet that can't tolerate hard surfaces because of poor circulation and nerve irritation. Number 8, walk with your feet and knees pointed straight ahead. Tip number 9, spread out your toes. Work that abductor hallucis muscle by spreading out your toes and big toe in particular as much as you can. A lot of people are unable to do this at first, but like most things, with practice, you can will your toes to move on command. Progress to putting an elastic band around your toes and holding it for a count of 10 seconds at a time and repeat 30 times. Number 10, toe curls. Curl your toes like an eagle catching its prey with its talons. Really exaggerate the motion. Number 11, golf ball roll. Get a golf ball and roll all the small little arch muscles. You'll likely feel tender spots that are tight muscles and tissues preventing your joints from moving properly. Number 12, calf stretch. Do a runner's stretch against the wall where you are stretching out the back foot. Make sure you keep the foot pointed straight ahead. Hold for 30 seconds with the knee straight and one time with the knee bent for a stretch closer to the ankle. Tip number 13, heel drops and raises. Go on the stairs and let your heels hang off for a stretch. Then raise your heels as high as they go to strengthen your feet and calves. Repeat 30 times. Number 14, pick up marbles, Legos, and bath towels with your toes. Work on your toe coordination by using your toes to pick up small objects off the floor and putting them in a cup. You can also scrunch up your bath mat or tissues. Number 15, side leg raises. One of the reasons for poor foot alignment is weak gluteal muscles in your buttocks. Lie on your side and lift your legs straight up in the air. Make sure you don't cheat by rolling your hips back. Rather, try to make sure your hips are stacked, one right over the other with each repetition. Number 16, if you're concerned about your child inheriting your bunions, keep an eye out for their foot, knee, and hip alignment. Tell them to think of their kneecaps as eyes. Their kneecaps' eyes need to look forwards, not at each other. Avoid W sitting where the knees are touching each other and the feet are apart, like the shape of a W. And do encourage lots of deep squatting to build up those hip stabilizing muscles. Also, as you've undoubtedly discovered, children's feet grow really quickly. Keep checking their shoes often to make sure there is plenty of room at the toe box. And finally, number 17, remember, if your bunion pain isn't getting better, do see a professional who can help diagnose your specific issue and determine if you need further treatment like individualized, hands-on work, injections, or even surgery. If you have some great health tips that helped you to fix your bunions, I'd really appreciate it if you could share them down below in the comment section so that we can all benefit in our personal journey to better health. Please like, subscribe, and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Also, please press that like button because it can really help get this information to those that need it. Thanks for watching, and I'll see you in the next video.